Hello, this is Dr. Wells with Wells Medicine, and I wanted to introduce a video series that I made to help welcome patients to ketamine treatment. In this second video, we're going to talk about things that we're going to cover during every visit, plus some of the things that we talk about special during the second visit, and some things to be watching for as you progress through the treatments. So after the first infusion, generally, patients notice, if they notice anything at all, a little bit of lightness or a feeling of weight being lifted off their chest, and that generally fades within 72 hours to 2 weeks. It's very common for patients to come back for their second infusion and say, I was feeling a little bit better, but then that went away. We do watch the quick inventory of depressive symptoms, the QIDS, which we give you before each infusion, to sort of trend any changes in your mood and kind of track in the most objective way possible something very subjective, which is how you feel. A lot of patients also start noticing that getting up in the morning is a little bit easier or doing things is a little bit easier, but sometimes that takes another infusion or two. After the first infusion, generally any side effects that the patient has had go away pretty quickly into that afternoon. And so we'd like to know about any side effects that you feel you've had after your first infusion when you come in for your second infusion. When you come in for your second infusion, we'll ask you if you were pretty floaty during the first one. We can adjust the dose either up or down to try to make it as comfortable for you as possible. You might want different music during your second infusion depending on how the first infusion went. Sometimes the music can make things a little bit more melancholy or a little bit more reminiscing or a little bit more cheerful, just depending on which track you play. There are some great Spotify tracks specifically geared towards ketamine. So those are things to look for in between infusions as well. We'll ask also when you come in for your second infusion if you found your supplements yet, the zinc, the magnesium, the vitamin D, the L-methylfolate that we talk about during your first infusion. And then when you come in for your second infusion, same thing. You'll come in, you get checked in at the front desk, come sit down, we'll start your IV again, and then we'll give you the ketamine infusion, again over 40 minutes. We'll talk as well about homework for the second infusion, and generally that homework includes trying to get outdoors a little bit every day. So there are some great lines of therapy, particularly in Japan, in England, but also in America in dialectical behavioral therapy that talk about grounding yourself in the earth, feeling sand or the earth beneath your toes, being outside, looking at clouds. So spending about 10 to 15 minutes every day outside to try to soak in the nature is very important. Exercise as well is going to be emphasized during this infusion. So trying to get, a nice 20, 30-minute walk in if you have depression or some high intensity interval training or other exercise that really gets your heartbeat up for anxiety is going to be very important. And we'll talk about that at this infusion. So this would be a great time to kind of look at any caffeine that you're consuming through chocolate, hot chocolate, tea or coffee, also stimulants and pre-workout drinks. For a lot of my anxiety patients, this is a time to think about just monitoring that. We'll talk a little bit more about it at the third infusion, but just monitoring, knowing what your intake is of those things can be really helpful. Because what you don't measure, you can't change. After this infusion, generally families will start to notice that patients are doing a little bit better, even if the patients haven't noticed at this point. We'll look for any side effects as well after that infusion. Generally, patients feel a lot less tired than they did after their first infusion, and no matter what the increase of dose during the second infusion, whether we increase it or not, generally patients feel like the second infusion is a little less intense than the first infusion, just because they kind of feel like they've been on the roller coaster once. They kind of know where all the curves are coming, and they can kind of guide it a little bit more. And they've been in that space before, which for patients that haven't used psychedelic medications in the past, or things like mushrooms or LSD, PCP, this is a very new experience. So for a lot of patients, that first experience can be kind of intense. I hope these videos are useful in preparation for coming in for ketamine treatments. And if they are, please let us know by liking, subscribing, leaving us some comments. Let us know what would be more useful for you to have information about. And I hope to see you in other videos.